There's a paper which has sent a ripple of anxiety through the clinical AI world titled Endoscopist De-Skilling Risk After Exposure to Artificial Intelligence in Colonoscopy, which is published in Lancet, Gastroenterology and Hepatology. Right, let's get straight into it. So for years we've talked about AI as a tool to augment clinicians, a safety net to help us perform better. This study asks a crucial question and frankly uncomfortable question: what happens to a clinician's skills when the safety net is taken away? Specifically, after endoscopists get used to an AI that helps them spot precancerous polyps, does their performance drop when they have to do a colonoscopy without AI assistance? The paper's conclusion is a sobering one. They say that yes, it does. It found that adenoma detection rates, a key quality metric, fell significantly from 28.4% down to 22.4% after AI was introduced. So a kind of 6% reduction. So the big idea is that constant exposure to AI might not just help us, but could actively erode our core clinical skills, creating a dependency that we can't easily shake. But now let's look at the evidence. Is the central claim built on a solid foundation? The authors based their conclusions on a retrospective observational study at 4 centres in Poland. With a reasonable start, this evidence has a critical limitation, and this is where a flashing red light should appear for any critical reader. The study is highly prone to confounding, being observational in nature, and so confounders are unmeasured factors that could distort the results, and the study has a potentially big one. In the discussion limitations section, the 8th of the limitations mentioned, the authors described that the number of procedures nearly doubled in the post-AI period relative to the pre-AI period, and this was due to a temporary suspension of Poland's national colonoscopy screening programme, which meant that the centres began working through their backlog of patients on the diagnostic waiting list, whereas in the pre-AI phase there were more screening cases. So this is a core problem. The before group was largely an asymptomatic screening population, and the after group was a symptomatic diagnostic one. This isn't just about different patient characteristics, it changes the nature of the task. I mean, I'm not an endoscopist, so I don't know full details, but my understanding is that a screening colonoscopy is more of a meticulous, thorough examination, hunting through the entire colon with the sole purpose of finding any and all polyps. Whereas in contrast, the diagnostic procedure is more of a focused test, looking for a specific cause for patient symptoms, like the source of bleeding in one particular area. The procedural mindset might be different in endoscopists, but the kind of precise reasons aren't necessarily important, but the key point is that they're fundamentally different patient populations undergoing procedures within different clinical contexts. So comparing the two is like comparing apples and oranges. The shift alone offers a perfectly plausible alternative explanation for a different adenoma detection rate, having potentially nothing to do with AI-induced de-skilling. So to build on these findings, we'd need to generate stronger proof. This would look like a randomized crossover trial where the same endoscopists are assigned to alternating blocks of using and not using AI with comparable patient groups. I think without that, it's an important flag, the study, but the claims remain speculative, needing confirmation. So while the findings are alarming, it's a hypothesis built on slightly shaky observational foundations. And we also must be mindful of publication bias, so studies with prominent or novel results are more likely to get published than maybe tens or hundreds of others looking at similar things which didn't find an effect. So from this alone, we shouldn't panic or restrict AI use, but we should treat this as a crucial but unproven warning. The immediate step is to demand more and better research, and we need to see this study replicated in a robust, prospective and ideally randomized fashion. If these findings are confirmed, then we have a real problem to solve, but until then, the paper serves as a vital reminder that as we integrate AI, we must not only scrutinize the machine, but also ourselves and how it might change our behavior.